Polio, a horrible disease that had been eliminated in the UK and most parts of the world through one of the most successful vaccine programmes in history. But apparently it's back, having been detected in a London sewage plant. Should we be afraid, and why is it here? Well, first off, most people are still vaccinated against polio in the UK. But with childhood immunisation programmes disrupted by the pandemic internationally, where the world recorded only a few dozen polio cases across 4 countries 5 years ago, that number increased to more than 1,000 known cases across nearly 30 countries. Yet this strain is suspected to have derived from someone who recently had the all vaccine, which is then mutated. Meanwhile, new figures show that in some parts of the country, mainly in London, 50% of teens have not actually been jabbed. So could we be at risk of polio taking hold? What is going on? Joining me now to talk about this is Professor Andrew Preston, who's a microbiologist at the University of Bath. Fantastic to have you back on, Andrew. Not talking about COVID for once, but polio. Should we be worried?
Yes and no. Clearly, polio, as you said, it is a terrible, terrible disease. And we thought we had it fully eradicated. So to find any trace of it back on these shores is a cause for concern. But as you also pointed out, this is not really sort of the endemic wild polio that we see remaining in a couple of areas of the world. As you pointed out, this is very likely to have derived from someone who's brought the vaccine strain with them after being vaccinated themselves and excreted it into the environment. But I guess the real concern is that this was detected in several samples over a period of months. And it's very, very unlikely that is a result of a single person carrying this. And so if it's multiple people, that does suggest that this vaccine-derived polio virus is transmitting between people in that London area. And that is a cause for concern.
So how does that work? Because I'm trying to wrap my head around having a vaccine and then that vaccine, the live virus in that vaccine, manages to get into the waterworks through someone's toilet and then has the possibility of infecting people.
So it's unlikely that the infection of those other people has derived from the wastewater in which the virus has been detected. It's just that we monitor wastewater for a variety of different things, so pollutants, chemicals, and indeed some pathogens, and that's really expanded during COVID. It was a highly sensitive sentinel for sort of where COVID was and its relative levels. So it's very much more likely that if this is being transmitted amongst people, it's the classic fecal oral route. So whoever's got it is able to maintain that live virus for a period of time. They excrete it into their environment. And as we see with many other diarrheal diseases, it's not that difficult for people to then become contaminated with it from their environment. So it's not as if it's spreading through the wastewater. That is just a sentinel to show that it is happening.
Now, most of the UK would have been vaccinated against polio during their childhood, but statistics they're showing that in some London boroughs, 50% of young people have not been vaccinated. Could that create a pathway, essentially, to the spread of infection and put those people at serious risk?
I think that 50% is probably referring to the teenage booster vaccine. We know that the levels of vaccination at childhood, so the polio vaccine is administered as part of what is now a hexavalent, so a 6-in-1 vaccine at the ages of 2, 3, 4 months, and was also part of the preschool booster at around 3 years and 4 months of age. There is a teenage booster of 4 different vaccines. We do see less uptake of that, but the real susceptibles, the very young, we know that the vaccination levels across the country for those initial childhood vaccines is up around 92%, but across London it is worryingly low at 86%, and that is below the level at which we would expect to see sort of that herd immunity protection.
Andrew Preston, thank you so much, and we'll keep you updated on this situation and catch up with you again in the future, I hope. Well, Patrick, what are your thoughts on this? It's quite complex, because when I first read the story, the first thing I thought was there are a couple of countries in the world where the polio vaccination has essentially been barred, countries where the Taliban operates as it happens. But this is slightly different. It seems to be someone who has been vaccinated and somehow it's released the live virus through their digestive tract. into the surrounding environs. It's quite worrying.
It is, and I think that's just the leading theory. I don't think they've ruled out the idea that it could be someone who's come in, from one of those countries where the Taliban operates and its immediate neighbour. And I think there's also another Central African country where, until relatively recently, polio was endemic. What it makes me worry about is, through political correctness, are we sloppy about health checks for people coming into our country from other countries? Because we've had TB really as a resurgent disease, particularly in our big cities, over the last 15 years or so. And I was reading a statistic this morning from the latest set of government statistics that suggested more than 70% of cases have occurred in people from outside the UK, who were born outside the UK. Now, I don't want to get too hardball about this, but I would suspect that we could be doing more, and I think other countries do more, to screen for these diseases before people come into the country. The idea of polio really becoming resurgent, hopefully it's not going to happen, is fairly terrifying. And there are particularly minority communities where the coverage of the vaccine doesn't seem to be at the levels we would want it to be. So ultimately there must be a risk of children getting this really terrible, debilitating disease, which can leave them with kind of lifelong paralysis of limbs. Let's hope the authorities have got a handle on it, but I would personally like to see much more stringent screening for infectious diseases, which we thought we'd eradicated in our country, to stop them coming in again.
Yeah, Patrick, thank you.